you, Aiden. All right, good evening, everyone. We are starting our school board meeting. I like to call the meeting to order at 9:04. If everybody could rise and say the pledge. The flag's here. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, so I will open to public comment, but I don't see anybody for public comment. So correspondence folder, Brian, is there anything real quick?
Yeah, we just have a couple of things in the correspondence folder. We put in your individual board member packets a legislative update from the New Hampshire School Boards Association, so I included that, and also a letter on behalf of the board written to the Family Dollar store thanking them for allowing Bartlett staff to park at the Family Dollar. So I'll send this around, but I wanted you to know that the legislative update is in your individual packets as well.
All right, thank you. All right, so we're just going to do a quick debriefing on the deliberative session on how we think things went tonight. Thank you for everybody that presented. Go ahead, Jared.
Yeah, just one thing, I think the board would agree, it was hard to hear individuals that were speaking, either at the podium or even hearing people that were addressing.
I hope it comes up.
That were addressing.
I wonder if people at home could hear, because it was very hard.
And conversely, I said it jokingly, but I do say that I think it's great that we got to Mountain View instead of just being at the high school. I think it brings the public to another school. And I would recommend that we look at in the future potentially doing Maple or Bartlett, again, bringing the residents to those schools to reinforce the needs that those schools have, I think would be a good thing.
Right.
Those are my 2 cents.
Thank you, Jared. Anyone else? And if I don't see your hand, just throw something at me or something. What was that?
Missing you tonight.
Yeah, he didn't come probably because of the weather. The weather was bad. So
I was texted by a couple people to see if we were still having deliberative session tonight.
yeah, this weather
Because of the weather changed. I don't know when we usually have a plan to say, no, it's canceled for the next meeting.
It's not freezing out.
But
It's not freezing now.
Oh, it's not now?
I didn't know if it was one of those, okay, at 6 o'clock we make the decision. If you don't hear by 6, it's a go. Maybe just having that communication.
I don't know what the cutoff time, if we had to cancel, because we have a snow date for Wednesday, what would have been the cutoff? So,
The time cutoff?
Yeah.
Probably 4 o'clock.
Okay.
I would think if we
Because
were going
you
to
have
make a
to
decision,
get it
we
out
would have made it
there.
by 4. And then had we canceled, I likely would have sent out a communication. We would have put some information on the website. This, in my opinion, this wasn't enough weather to warrant all of the rescheduling and all of the unintended consequences. So, I mean, what we're dealing with right now, the temperature should be raised. It's already heading up, but it's weather. It's New Hampshire. It snows. It rains. It spits. We're okay.
We can handle it.
Anyone else? I think the questions were good. Go ahead, Scott.
I also wanted to let you know that the town administrator echoed what was the superintendent's suggestion about a month or 2 ago, was having a combined one on a Saturday, and he is going to present that to the Board of Selectmen at the next for next year, that the deliberative session would be on a Saturday, the school would be in the morning, the town would be in the afternoon, and this way it's one and done for the whole community. So, and Brian did bring that up, and we talked about it with a number of articles, and that we had, it might be a little bit of a challenge, so we didn't do it this year. But that's something that could be on the horizon in terms of a one-day event, morning for school, afternoon for. Just saying.
Right. That's a good idea. Yeah. Anyone else for discussion on deliberative? No? You're good? All right. So we'll move on to superintendent's report. Go ahead, Brian.
Thank you. So just a few important things that I wanted to share with the board this evening. So I'm not going to go through kind of my normal full report, but there were some things that were time sensitive that I wanted to bring to the board for your consideration. And the first of which is the school calendar. I'm not asking you to take any action on the school calendar. We don't have to submit the calendar to the state until the beginning of April, so we have time. But I would like you to be aware that the calendar is in your individual board packets. We'll talk about this at likely your next meeting or your first meeting in March. And I do want to point out this calendar is 181 school days. So I'll provide a little bit of context for people to understand this. And some of you who've been around for a while, this will sound very familiar because I have in the past brought a calendar that is beyond the required 180 days. So the state requires a minimum number of 180 days, or you can do a calendar based on hours. We continue to do a days calendar, and this has one additional school day beyond the minimum state requirement. So I do want to share that with the board. A couple of other highlights. There are a number of elections next year. We have a primary on September 13th, as well as the general election the second Tuesday in November, as well as the local elections the second Tuesday in March. So we have 3 voting events that will happen during the next school year. And I would also point out that after, I think, 9 years of Mrs. McGrath relentlessly encouraging me to add Columbus Day as a school holiday and a holiday, I have acquiesced to that. So Mrs. McGrath was, she persevered, and the calendar that you see does include Columbus Day again. So we have not had a holiday on Columbus Day for the last 9 years. So I'll leave that for your review and consideration. The second thing that I wanted to bring to the board's attention, and this is a little more time sensitive, but the large piece of paper, I think this would be 11 by 17, that is in your packets. If you take a look at that, this is an overview of the Mountain View Middle School Principal Search Committee, and the team has been meeting, has had a number of meetings, as you can see in the current order. But you'll see here that based on input from the committee, we'd like to slightly revise the order of these events. And Mrs. McGrath is here to be able to speak to this, but specifically, you'll notice that the left-hand side says current order, and next to that is a column that says revised order. So what we're essentially recommending is that the school candidate visits, the candidate on-site visits to Mountain View, as well as reference checking and final interviews with the superintendent be slightly modified. And this was at the recommendation of the committee. Mrs. McGrath, do you want to provide a little additional context to this or any additional information?
I think if we were to talk further about it, we would probably want to go into non-public.
Yeah, so we're talking about hiring, so we can certainly have a discussion in non-public session, but I thought it would be prudent, just that this is a process element, that unless the board disagrees, we'd like to just slightly alter this process. I don't think you need to make a motion if the general consensus is that this is permissible from the board, and then we're happy to discuss this with more detail in non-public if the board would like.
How does everybody feel?
I don't know if it's my public, but my question would just be, what was the rationale for changing it around?
Kate?
Non-public.
Okay. Thank you.
Right. Anyone else? No? Okay, go ahead, Brian.
Okay, so and then the last piece that two more pieces. I wanted to give the board an update on busing. Mr. Gross and I have been very busy meeting with the bus company, and the bus company has made some good progress since your last meeting, so we have had less cancellations and less delays. I think the worst of our bus driver absenteeism or shortage of drivers is hopefully behind us at this point. I also wanted to let the board know that the person who was the terminal manager has retired, So there is some new leadership going into the truck center. So they have right now 3 assistant terminal managers from other locations that are helping cover Goffstown. So we're looking for kind of the next phase of hiring the next terminal manager. But they have been very responsive. We've been sending information out to parents. We've had to do, just today, we did permanent consolidation of 4 runs into 2, and we had been doing that almost on a kind of a daily or depending on the route basis, but we've continued to make progress. Scott has been very involved, Mrs. Morin's been involved, we've all met with the truck center, they've come over, we've reviewed a number of things, we've had meetings with our higher-ups who handle our account, and hopefully at this point we're trending in the right direction. So it has been a challenge. I appreciate everyone's flexibility. Parents have been very understanding. But again, I recognize that this has been a terrible situation for families, for kids, for the disruption of learning, and I feel very badly about that. But I think at this point, we're trending in the right direction, and hopefully the worst of it is behind us. And then the last piece that I wanted to share with the board, and I wanted to go over this, just to spend a few minutes on this, and then we can have more discussions at a future meeting. But because our next meeting is our mid-year retreat, it won't be a regular meeting, so I wanted to provide you with a draft copy of a revised emergency operations plan for COVID. And this would, consistent with what we've done since the beginning of the pandemic, this would be a regulation, a temporary regulation to policy EBCF, which is Pandemic, Epidemic, Emergencies. And I'd like to discuss this just a little bit because this represents a pretty significant shift in thinking and ideology. Last week on February 2nd, the Bureau of Infectious Disease Control provided schools with a new overview. And there was a meeting that was held last Thursday with Dr. Chan, who's our state epidemiologist. And at that meeting, they shared this new document with the from the state with the school districts, and they highlighted a number of significant changes. We are no longer doing individual case reporting of any COVID cases effective this week. So prior to this week, we had to report every single case through a secure online portal to provide information to the state. That has now stopped. We are now doing some version. We don't know quite what it is yet because it hasn't been released, but we will be providing a weekly summary aggregate reporting of positive cases for staff and students. So that's new. The state is no longer tracking clusters or outbreaks. That's new. And in fact, they shut down the section of the dashboard from the state website that housed all of that school information. It's gone. There's now a 1 paragraph that says they've moved into a new model, a surveillance model, and all the previous data is no longer there. So what you have before you with the big watermark of draft on it, I wanted to provide this to the board and allow you to have some time to read this, to understand it, and to digest it, because this really represents changing pandemic ideology. And what do I mean by that? So I'm not suggesting that this goes into effect immediately or that the board takes action on this, but in my opinion, this is the next phase of how we respond to the pandemic. So I wanted to get this to you as quickly as I could. We just completed this draft this afternoon, so this is pretty hot off the press. But what you'll see here, when I say changing pandemic ideology, 3 key points I want to make. This emergency operation plan represents a shift in pandemic response, moving from a prevention model to one where we learn to live with COVID-19 in our schools. So we have spent so much time, energy, and effort in the interest of trying to prevent any COVID transmission. This represents a different way of thinking about the pandemic. Second one, this emergency operation plan represents a shift in public health away from universal case investigation and contact tracing to focus surveillance and public health efforts on preventing severe outcomes of COVID-19. That is the shift that the Bureau of Infectious Disease and DHHS, the Department of Health and Human Services, is referencing. So now, and they have a document, and And these things are all hyperlinked, so if I gave you the electronic version, you could click on each one of these things, and it provides you with the position paper on moving away from this universal case investigation model. And third point is, at this point in the pandemic, vaccines and testing are widely available. And as such, this emergency operation plan focuses on individual responsibility and choice rather than mandated mitigation measures. So let me go through and tell you what's different and what's the same. Responding to individuals with COVID-19 or someone who has symptoms. Essentially, this piece has remained unchanged. So if you are positive with COVID-19, there are requirements for you to isolate and to be out of the school environment for a minimum of 5 days, and then you're allowed to return with certain prevention measures like wearing a mask. Now, this also is true if if there's a positive COVID case in a household contacts still have to quarantine. So those pieces from the state are unchanged. Isolation, quarantine remain the same. And I'm sorry, Janelle, I've got my back to you a little bit. So those pieces don't change within the pandemic. And I highlighted some of the action steps that the state continues to encourage us to consider. Now, for reporting, I already mentioned that we are no longer reporting individual cases and that we'll be submitting a weekly aggregate of some kind. We don't know yet. This week will be the first one. At some point, we're going to get a copy of what we need to submit, but we will start doing that. Whatever we're required to submit, we will have a public-facing element on our website so that people can see that data. So Mr. Bourget, sitting quietly by himself in the back row, will have to put some kind of a new database on our website so that people can see what we're reporting to the state. Now, we haven't been required to do contact tracing, but I want you to know that we will continue to do that through cohort contact tracing. This is a slightly different approach. Essentially, what I mean by cohort contact tracing, and I'll use an elementary school as an example. The different kinds of cohorts that we might expect within an elementary school would be who rides the bus, that's a cohort, the classroom, if there are combined classrooms such as special education services or anything like that. If it's the middle school, it might be an academic team. It would be all co-curricular or athletic teams. These are the different groups that we will continue to monitor and track if we have positive cases, and we will continue to provide notifications to those people that they were potentially a close contact. We don't have to do this, but we're still going to. I think it's good for people to know. It is work on our part, but it's work that our administrators and our nurses believe in. We think it's important to be clear with our families that if we have positive cases, we want them to know that. So that's new and that's different. So we will continue to provide that notification, but we will likely transition away from the daily emails of how many COVID cases we've had. That's all available on the website. So I'm looking to scale back some of the communication because people really aren't paying attention. They've stopped reading them weeks ago, unfortunately. So for contact tracing, again, we're adopting this premise of a cohort contact tracing model. And then for testing, we will continue, as the board knows, we have a lot of options for testing. We have asymptomatic testing, we have close contact testing, and we have symptomatic testing. The next piece that I had shared a couple weeks ago, we're investigating the ability to send tests home. So if we're able to do that, that's a new piece that we're chasing after, we will do that. So all of our testing pieces will remain. And then the last part of this on page 3, identifying and responding to outbreaks. This is a fairly significant change and shift, so I do want to make sure that this is clear to the board. As I said, we are not required to track or monitor for potential outbreaks anymore. Now, an outbreak is a state definition. If you have a cluster, which is 3 individuals who are part of a group or a setting that have the potential of transmitting COVID, that's how you get to a cluster. 2 clusters equals an outbreak. The new document, Responding to COVID-19 in K-12 schools and school facilities, childcare facilities, dated February 2nd, uses a phrase that we have never seen in any of the literature put out by DHHS. and they talked about uncontrolled transmission. So instead of thinking about an outbreak as being a reason to institute universal masking, we're going to look for outbreaks, but we're going to look at uncontrolled transmission. So if we believe that we have COVID being spread in our schools, then we would have the ability, based on what I'm proposing to you, to authorize the superintendent to implement mitigation measures for cohorts or schools as needed to respond to uncontrolled transmission, including but not limiting to masking, distancing, cohorting, cleaning, disinfecting, etc. The superintendent will notify the school board of any mitigation measures put in place. The document responding to COVID-19 in schools, February 2nd document, says that schools are allowed to contact the state for help if we suspect uncontrolled transmission. I would recommend that we would do that, and then we would continue to follow the recommendations for how to respond to COVID-19. So essentially, this would move from masks being targeted, that we would not have a targeted mask model, but only mitigation measures would be put in place if we were responding to uncontrolled transmission. So this is a different way of thinking about this. This is a different model.
Define uncontrolled.
It's interesting because the document that I keep referencing has a number of definitions at the back, definitions of key terms, and uncontrolled transmission is not one of them. I would be happy to make my own definition. I would say that if we have evidence of school spread, that's when we would respond with mitigation measures, and anything short of that, we would not. So mask optional would be truly and completely mask optional. So absent an outbreak with uncontrolled transmission, at this point in the pandemic, we would move to a individual choice type response and not continue to implement any kind of targeted masking around clusters, outbreaks, etc. So this is, I'm happy to answer any questions, but I wanted you to kind of take this all in, understand this, and then I thought it would be helpful in preparation for your next meeting when you might consider this further.
Jared had his hand up.
Brian, just because you mentioned it, what would be your definition of an uncontrolled transmission? Or could you provide an example of what that would look like?
Yeah, I would say uncontrolled transmission would be any school spread that we can really clearly point that school was the location where the transmission was occurring. Now, uncontrolled again, I can come up with a definition for that, and I would think it would make sense if the state did, so that it's a common definition, so that everybody doesn't have their own definitions. But I would say evidence of school-based spread. And up until this point, I've shared with the board pretty consistently that the majority of all of our cases have been outside of school, outside household contacts. I do think with some of the clusters that we saw, there's a good chance we did see evidence of school-based spread. And only under those kinds of circumstances would we then respond, or would have the ability to respond. So again, I'm getting to the point where I want the board to recognize that this is a shift away from us trying to prevent the possibility of school-based spread, and to now move into the next phase. The cases have dropped considerably. Hospitalizations are half of what they were a couple weeks ago, and I think in another 2 or 3 weeks, you're going to continue to see the cases really plateau out. So when the board is ready for the next kind of step in an emergency response plan to the pandemic, this is what I'm recommending.
So this would be further discussed at our next meeting, February 21st, which
Correct.
is a retreat at St. Ace.
It is at St. Ace.
Yeah, we'll get more. Yeah, 6 o'clock. So we'll do a school board meeting before, and then the retreat after. Go ahead, Jared.
Thank you, Ms. Chair. Brian, I'm sure you're sharing this with New Boston at their next meeting.
I will be sharing this with New Boston tomorrow night.
Okay. Because I know that we've tried to have that relationship with them of how we're dealing with it in our schools. I know that they have some different mindsets sometimes. it'll give them an opportunity to also listen and provide.
Yeah, and again, the premise here, Jared, was this is a board decision of when you want to do this. And it could be that you don't want to do this until July. It could be that you want to do this next week. I mean, really, that would ultimately be a policy decision up to the board. But I at least wanted to lay out conceptually based on some of this. And again, this shift from the state happened very abruptly, shocking. No one had any sort of pre-knowledge that there was going to be this significant shift in what occurred. In fact, I'm fine sharing with the board. I wasn't able to be on the call and didn't hear this firsthand. And then the next day, Kate and I both said, "What did they present?" So we got a copy of the PowerPoint, and then we found the document, and then as a result of that, I changed the emergency operation plan to be more aligned with the clear direction that the state is going in.
Go ahead, Kate.
Brian, would you mind elaborating the mask optional, but the one time when it's required when folks return from quarantine and isolation?
Yes, good point. Thank you, Kate. So if you have COVID, up until fairly recently, you were removed from the setting for a minimum of 10 days. The change, and we adopted these changes, the board will recall, in our quarantine and isolation guidelines. The CDC recommended adopting a 5-day isolation period, followed by 5 days of mandatory masking. That still remains in place. So if anyone doesn't want to wear a mask upon return, they're welcome to stay out for 10 days and not 5. So thank you, Kate, that's staff and students. And this also, and maybe I should add this as well, masks are still required on the school bus per a federal requirement. So that is not a state requirement, nor is it a local requirement, but that also would remain. And maybe I'll add both of those pieces to make them a little more clear.
All right.
Thank you, Kate.
So we'll plan to bring this back February 21st with any questions and if we want to move it forward at that time. All right. Anything else?
Yeah.
Go ahead, Jenny.
Do you know what the aggregate studies that you're sending to the state to?
Yeah, I think what we believe it's going to be, Ginny, is it's going to be two numbers. It's going to be, this is how many weekly student COVID positive cases you had. This is how many staff adult cases you had. Not separating them by school, not separating them by age or level, just those two numbers. That's what we think they're gonna require. But it's due this week, but we haven't gotten it yet. But we'll get it done.
All right,
So
thanks.
this is just going to be, hopefully everyone tells the truth about what's going on.
Yeah, I think it is. And I can share a little bit as to the why. And one of the things that the state shared here, and I think this really sets the groundwork, they talked about, given the increasing use of at-home tests, tracking every COVID-19 infection is neither possible nor necessary for managing the pandemic. So the part of the premise that the state is using is so many people are using at-home tests now that the state has lost control over who's positive, who's not, how many tests are being given, what's the positivity rate. No one knows anymore. And so that's part of the shift, is that this is consistent with a national trend transitioning away from universal case investigation and contact tracing to focus on surveillance and public health efforts in preventing severe disease. So this is really, it's an ideological shift.
So do we require a copy?
Yes,
Picture of that?
we do. We do. And of course, we also get a lot of our testing, the majority of our testing still is from our own testing program. So it's the individual PCR tests that we're doing, the individual antigen tests that we're doing. That's still where we get the majority of our positives.
Okay. All right, anybody else have any other questions for Brian? All right.
Well, thank you. I appreciate, and I know it's been a long night already, and I know that we still have a fair amount of non-public, but I at least wanted the board to have have this document to be able to kind of think about this, think about questions that people may have, and we'll continue to discuss it at your next meeting.
Thank you, Brian.
Thank
All
you.
right, so we're going to, after we do the motion in non-public, we're going to go down the hall to another classroom so GTV can break down. So I'll need a motion to go into non-public under RSA 91A32C, matters which, if discussed in public, would likely affect adversely the reputation of any person other than a member of the public body itself, unless such person requests an open meeting. This exemption shall extend to any application for assistance or tax abatement or waiver of a fee, fine, or other levy, if based on inability to pay or poverty of the applicant.
So moved.
So I have a motion by Ellen. Do I have a second? By Janelle. I will do roll call. Ginny?
Yes.
Retta?
Yes.
Jared?
Yes.
Shane? Yes. Janelle?
Yes.
Terry?
Yes.
Ellen?
Yes.
And Heather, yes. So we're going to go into non-public. So it's the fax room down.
All right.